Hey, it's Lauren. Welcome back to another research paper explained, and today we're going to be diving into the genomic profiling of sporadic multiple meningiomas. So it's a little different from the last one specifically, and the topic that we're focusing more on meningiomas in adult patient populations, but let's dive into it, and I'm going to review and share some highlights, takeaways, and discussion points from this paper. To a mic this time. So we're focusing on the neuroanatomical structure of these multiple meningiomas. So essentially, for just some background information, around 10% of all meningiomas occur as multiple tumors, hence the name multiple meningiomas, or the abbreviation MM. And these are in two different forms, as well as different radiation-induced cases that could have more of an aggressive clinical course, and again, also have more of a higher predisposition for reoccurring. At least that's what they stated here. So essentially, what the status quo for care for meningiomas, one, obviously, to have your maximal safe surgical resection for these tumors that at least are growing substantially and causing a lot of symptomology. But then within that, having multiple tumors obviously will present its own kind of basis of challenges. So within there, prioritization is kind of the one way that they would like decipher whether or not to do maximal total resection or not, but obviously better patient outcomes do prevail, and we'll go into that later through this paper, with having the most number of tumors resected in one surgical operative setting. So if you could try to get the most at one time, it's more optimal for patient recovery. It's also too, when you think about different resources in the hospital systems and maybe being in an area that is in certain geographical locations or demographics that maybe don't have access to trauma level 1 like care centers, ensuring that you can do the procedure all in one go, or at least as safely and as productively as possible in one operative case, that would be incredible. So basically what they're doing here is to see what kind of molecular and what kind of genomic predispositions, or I guess like biomarkers, could we look at that are within these driver mutations, but also can help guide like improving patient prognosis and better patient outcomes. So that's exactly what they said there. Yeah. So this is especially why the characterization through these sporadic multiple meningiomas are so crucial towards having good patient prognostics. Wow, it's really bright. So within multiple meningiomas, typically there's kind of well-known inherited driver germline mutations. So important to note in their methods, they excluded any patients that had radiation-induced multiple meningiomas or those that had a germline mutation that could have been potentially related to a meningioma formation were excluded. And through this, they had pre- and post-operative MRI imaging and CT scans for each patient that they ended up evaluating. This classification, which they used before the location that they had to kind of differentiate what the tumor was pre-op and post-op, was just like with their EOR, which is the extent of resection. They use the Simpson grading scales, 1 to 3 being considered GTR, so gross total resection, and then having like the proximity of one meningioma to another with the individual patient was like determined through using like the center to center and an edge to edge distance through closeness between these tumors in the calculations. They did like tumor pathology, but I think what's even more important is understanding like the risk factors that they were looking for sporadic multiple meningiomas. And this is again the process that they were using to get the genomic analysis through the subgroup classification for these. So not only did they have like tumor DNA genomic samples, they also had it from the dura, and with the blood from all the cases, they extracted it. And then this was just the techniques for the sequencing technology that they ended up using. Again, here is it talking about the mutations. So what I think is really cool is, one, with the multiple meningiomas, there's a lot of genetic features. So typically they occur, as in multiple tumors, same patient, without a germline mutation. And then despite having a lot of research in this field, and this is not to hate on this research paper, they are actually identifying this, but there's a lot of reviews of multiple meningiomas, which these frequent mutations and other genetic alterations seem to have a play into whether or not someone is like at a predisposition to develop multiple tumors or multiple meningioma tumors in especially. And then through that, there's a couple kind of relevant mutations. So you have your somatic NF2 mutation. It was a very prevalent one in this case. There's also different distinct driver mutations. So for sporadic multiple meningiomas, these driver mutations really kind of indicate whether or not how complex this is from a genomic like divergence sense. And then like the presence of such driver mutations, which they talk about here, can really give into the like origin and the molecular heterogeneity of these sporadic multiple meningiomas. The last paper video I did, I gave a good example of trying to use artificial intelligence to locate kind of a tumor, and I gave the example using an analogy. If you're stuck in a maze and you have your beginning point and your end point, but you're stuck in the middle and you're not really sure how far away you are from those other areas, and you have to kind of integrate your way into figuring out how to get back to your ideal location. For this, it's kind of similar, but it's more in the sense of like, now that we have these prevalent genomic examples, or not examples, like predispositions and complexity, through that it kind of can give the origin of where these tumors are developing. Do they have an origin that is independent from like the molecular genomes that it's sequencing from, or is it dependent from the origin? And it can kind of give more integration into seeing how, if these driver mutations are similar, if they're not, and whether or not the prevalence of it can also help how you treat them, and then hopefully how you can improve just prognostics and early detection, early diagnosis, early integrative treatment. And yeah, so again, like I mentioned, the somatic NF2 mutations are a common genetic risk factor, which they mention a lot over here. And these are like frequently associated with the development of sporadic multiple meningiomas, which again highlights like the significance of having a genetic risk factor if you have this mutation. I would also say too, while they're typically not known for having germline mutation associations, they can also manifest due to like inherited cancer syndromes. So one that they looked at was the NF2, so neurofibromatosis disease type 2, which is what the NF2 stands for. But they're more typically commonly related to having somatic genetic alterations rather than like sole germline mutations. Here is a beautiful example showing the different classifications. Here you can see the different lesions. So this was their S2 case. So you can, or S2, okay, so that's the one lesion. This is an MRI of the frontal and occipital lesion, which you can see here and here. And then these are the S2T2 and then our S2T1. These are marking the different tumor locations. And then here is the stain magnification for the different grades of the tumors. And then here is giving us kind of the tree, to the phylogenetic tree, to see if they're inferred from the somatic different lesions and their like kind of genetic similarities. Somatic NF2 mutations and like the rare occurrence of multiple tumors within like the absence of non-germline tumor mutations is still unknown, which is kind of something they say here. So while there's also two limited genomic screening methods without considering like different events that could play into the formation and progression of multiple meningiomas. So without having a comprehensive and unbiased genomic analysis, you can really kind of understand and demonstrate, at least what they did in this study in particular, to see in the same patient if they have a genomic and histological heterogeneity. And then also to understanding if like they have a monoclonal cohort, which also says how multiple meningiomas can be mono and multicolonial. So essentially, for this study, there were some limitations as multiple meningiomas are rare. And the sample size that they used, it reflects this due to the small cohort. But the usage of having a really comprehensive genomic characterization really allowed for a better in-depth evaluation of the genomics for these specific types of tumors. Also, like they said here, it really provides insight into the clonality and understanding the focus on how you can understand intertumoral heterogeneity within MM patients, so multiple meningioma, and how one tumor cannot actually reliably represent that of the other ones in the presence of a case that has multiple tumors. So again, having possibly more clinical implications due to this. But like they said here, a lot more in-depth studies would be more optimal to really understand this like behavior and the clinical kind of relationship between the eventual outcome of patient prognosis and the different clinical implications that can come with the presence of having multiple meningioma tumors. Also, to the significance of when these tumors are occurring. Are they sequenced together? Are they more occurring in different kind of neuroanatomical regions? All those kind of questions are super valid. But they really kind of emphasized the unbiased and importance of having unbiased genomic analysis to understand the variability and the complexity of these genomic backgrounds for multiple meningiomas. And they do recommend to have surgical management for multiple meningiomas on an individual basis, with surgery aimed at removing the most number at one time when feasible, as I mentioned in the beginning. So yeah, that is basically the conclusion for this research paper review. Hey, if you made it to the end of this video, thank you so much for watching. I just wanted to put a really quick disclaimer that I'm very kind of new to all of this content, and I am a first-year undergrad, so some of it's quite new and in-depth, but I'm trying to kind of gauge my level of clinical knowledge and just understanding for like the whole kind of molecular biology and genomics of neuro-oncology. So if there were any errors that I had through kind of my analysis in this paper, or any mispronunciations, anything, feel free to comment below or let me know. And I'm always looking to improve, to learn more, and understand more about neuro-oncology and how we can use different integrative biomedical applications and technology. So I hope you enjoyed my second research review paper in the series. More to come, and thank you so much.